Well, Jonathan, we started with a 20-year-old with really extensive disease, refractory to topical therapy. Giving this patient a systemic or phototherapy seems to me to be a completely appropriate approach. Nowadays, I would be very quick to give patients dupilumab in a situation like this. What are your thoughts?
I agree. I think, there's, of course, access and insurance issues that have to be navigated in the real world. But when those are not issues, I think this would be a good candidate for dupilumab, and for that matter, for pretty much any other systemic agent if we couldn't get access to it. There's probably still opportunities to optimize topical therapy a little bit more. But as you described, I mean, at some point it just becomes, not feasible. And the combination therapy approach here of optimizing topical therapy a little bit more, as well as a systemic agent, I think makes a lot of sense.
I imagine you've had a lot of experience with dupilumab, and you look at these efficacy rates of roughly 40%, maybe give or take, in the clinical trial. Is your experience that only 40% of patients do well on the drug?
Yeah, so I think the numbers are pretty correct, but you have to know how to interpret them in the sense that the other 60% are by no means non-responders. I view the 40% as being super responders. Those patients who just do so phenomenally well that they may use topicals never or fairly rarely. Whereas the other patients, the majority of them are doing quite well, but they may need to use topicals a little bit more in conjunction with, and they may do very well, but they may not get 100% clear. And so I think it's important to just, have patients understand, or have realistic expectations in this respect, that some will get just complete clearance and others will maybe not completely clear, but do just fantastic, but, they still have some active spots. So I think the numbers are valid. It's just, you have to know how to interpret some of these trial outcomes.
It's great having all these options for patients. Let's talk about what's coming.